Good evening, everyone. A very warm welcome. My name is Shakuntala Santhiran, Shaks for short, and I will be your host this evening. We begin this VitalTalks event with a question, a key question. Can data end gender-based violence? 1 in 3 women worldwide has been subjected to physical or sexual violence in their lifetime. 1 in 3 women, which means it's highly likely that all of us here either know someone or we might have been subjected to this violence ourselves. It is an alarming statistic that barely scratches the surface of this global atrocity. Even the best estimates of gender-based violence likely fail to capture the true extent of this problem. This insufficient, incomplete evidence hampers efforts to address this violence, and it poses a life-threatening risk to an unknown number of people who need better protection. Our speakers who are with us this evening are using innovative data and advocacy to help bring this problem out of the shadows and into the public eye. They're helping to shed light on the true burden, galvanize action, and measure the impact of our solutions. We are honored to have them here with us today. You will get a chance to ask them your questions during the Q&A session. We hope you will get engaged. We have a full program for you. We begin with opening remarks from Fatima Mourinho de Souza, who is the principal technical advisor of women's health and gender equity at Vital Strategies. Fatima.
Thank you, Shaks, for this warm welcome. Good evening, everyone. It is a pleasure to be here with you to debate gender-based violence, a big challenge for public policy. GBV is a public health problem with high prevalence. Various forms of gender-based violence include physical, sexual, and psychological abuse from intimate partners, sexual violence by non-partners, sexual abuse of girls, and trafficking of women for sex. The most persistent form of gender violence is the abuse of women by intimate male partners. Women suffer violent death through homicide, suicide, maternal disorders, and HIV/AIDS. According to our work in Brazil, key predictors of GBV are women ages at 14 to 39, the use of alcohol by a partner, the racial disparities, and have children, among many others. According to a Vital Strategies case study in a city in Brazil, women who are registered as victims of violence are 3 times more likely to die by suicide compared to women in general population. And the risk of suicide is 4.2 times higher if the woman is aged 20 to 29. What response are we giving to these women? What can be done to support the management and prevent violence against women? Shedding light on GBV is essential. Use the information available better. Understand the factors and developing evidence-based intervention can prevent violence against women. Mapping violence, notifying violence from health facilities, capacity building to identify and report GBV, and building flow to the medical, legal, police, and justice system. Supporting countries to develop and implement a national policy and budget to address violence against women. Vital Strategy works to strengthen public health systems. This system can play a fundamental role in preventing and responding to gender-based violence. We analyze public health data to identify missed opportunities for health services in addressing violence and predictors for femicide and all types of domestic violence. making full use of the data that generate evidence about the magnitude of gender-based violence. These data are essential to inform public health policies and support intersectoral policies to prevent violence. Empower women and girls. Data for action, and it should be fast. We must take action when life is threatening. Vital Strategies is committed to supporting countries to end GBV. We stand with women and girls in solidarity and must work together to eradicate all forms of violence. Let us build a society where every person, regardless of gender, can live free from fear and harm. Thank you.
Thank you. Thank you very much, Fatima, for setting the stage for our conversation. Let's now welcome our expert panel to come up here and join me, please. We have with us this evening Márcia Lima, who is the National Secretary of Policies for Affirmative Action and Fighting and Overcoming Racism at the Ministry of Racial Equality of Brazil. Erin, who is Sexual and Reproductive Health and Rights Specialist at the International Center for Research on Women. And Leila Milani, who is Program Director of Global Policy and Advocacy for Futures Without Violence. And last but not least, Ruxana, Jina, who is Director of the Data Impact Program at Vital Strategies. Thank you also very much for being here with us. So as Fatima was saying, there are many different forms of gender-based violence, including violence against men and boys, although women and girls are disproportionately affected. Here's a question for all of you. Gender-based violence is drastically underreported. Why is that? Is there a culture of silence around GBV? If we could start with you, please, Roxy.
There's an issue around the culture around gender-based violence, but also I often think about the barriers in like sort of 3 layers. I think about the individual, and often it's the factors around stigma and whether the woman would be persecuted if she then reports it. The second is looking at the relationship with the perpetrator. Often we see it's the intimate partner, who's perpetrating it, and what's her relationship with that partner. In children, we often see grooming, and so children don't recognize that as a form of violence as well. And then we see the structural and societal barriers, as we mentioned, the cultural issues, but also do they have access to services? Do they have ways of reporting it? I think another important aspect for me is this issue around reporting and linking reporting to services. So this is a very personal story. I'm from South Africa, and the only way you could access medical care for after a rape is if you actually reported it to the police. And so, that woman wouldn't want to follow that pathway of reporting a case because often they wouldn't see the potential of having any outcome, looking at how many cases actually go to court, how many cases are actually prosecuted. And so you wouldn't report cases, but then it also then limits your access to medical care. So trying to think about how the systems are organized can also influence the reporting. Thanks.
Or lack of it.
Or lack of it.
Leila, what are your thoughts?
Well, I wanted to touch base on the power of the data and what's missing in that story. And I do policy advocacy, so I tell the stories to members of Congress or the US government to try to bring about the change. And so just in the opening sentence in the program, it starts with 1 in 3 women experience some form of gender-based violence, sexual violence during their lifetime. So with that data point, what other story are we telling? Do we even know the rest of the story? Do we know everything you just mentioned is not captured in that data point, which is what are the laws of countries in terms of responding to a woman who reports it? What are the cultural barriers to women reporting or girls reporting? What are the customary practices in the community when a girl or a woman has been exposed to violence or sexual assault, which is even worse? our data points will give us that 1 in 3, but they won't give us all the other barriers in society. And that right there gives you a picture of how the missing data can cut the narrative, can cut the conversation in terms of solutions and advocacy for things that need to happen. What are the steps towards prevention? What are the social norm change work that needs to take place in the societies, our society, to prevent the underreporting from happening? So this is actually the very beginning point. Is I see in my work this 1 in 3 data point, and I have to be honest with you, it doesn't do anything to move the needle in trying to get a member of Congress or a US government administrator to make a difference. What will make a difference is telling the full story. And we need the data to tell the story, to make the numbers, the high numbers, bring it to a personal level.
Because behind every number is a personal experience. So, Erin, what, in your experience, why is there so much underreporting?
Yeah, I mean, I think they really touched on a lot of it. There's a myriad of reasons why one single individual woman decides not to report her experience of violence, but help seeking and choosing to seek help is really intrinsically linked to the response and prevention systems that we have in place. And the harmful gender norms that kind of underlie our culture, our society, everything that we do also underlie all of the structures for response and prevention in person, online, however it is. And it's just deeply unfriendly for people that have experienced violence, but even more unfriendly for women that have experienced violence. And it really just advocates against reporting.
Márcia?
Okay. First of all, thank you for having me here. I'm representing the Minister of Racial Equality, Aniele Franco, who couldn't attend this invitation, so I'm here to represent her. And the gender violence is a very, very important agenda for us, especially because the minister, her sister, Marielle Franco, was murdered, and the political violence based on gender in Brazil is very, very serious problem. And we work together with the Minister of Women in Brazil. We have this minister, so for us, it's a great pleasure to be here with you and discuss this agenda. And also I'd like to say Vital Strategy Brazil is a very important player, it's a very important partner. I used to work with Fatima in the project about COVID, and for me it's a great honor to be here. Thank you. About this under what?
Underreporting.
Underreporting, sorry. My English is so tired. It's like, data is knowledge, knowledge is power. That's the reason we don't have so difficult to produce gender violence-based data. So GBV in Brazil is underreporting due to several reasons. The first one is the culture of the silence among the families. It's a cross-class situation. Middle class, high class, low class, everybody. This culture of the silence is very, very important to understand why people don't report gender violence. The second one, I think this, I follow some research about Brazil have a special precinct about gender violence, and there is the financial dependence of women by their partners, their husbands, is another question. When they report the violence, they can lose their home, and the children can be more vulnerable. So that is the financial power is a very important question when you try to face this problem in Brazil. And also, I think there is no priority of the government to create good information about gender violence. So I hope this new government in Brazil, the last 6 years, it's been a nightmare in Brazil, especially it's blackout data. We don't have information. And now we have more ministers, more such as I'm trying to translate the name of the minister. Brazil, you have the name of the minister are so big because it's the size of the problem, as I used to say. And we have a special secretary about transparency to work on to improve the quality of the data and the quality of information you can get in different database and public administration data. So that's I have some hope we can improve how we collect data about gender in Brazil, especially about gender violence. But it's important to speak up about this. It's the different kind of violence, the gender violence. It's not only domestic violence, it's not only political violence in Brazil. Is very serious question. Don't have no way to know how you can collect this data. So it's a challenge for us to think how you can collect data about the political violence against women, public women in Brazil. So I think that's my first.
Thank you,
answer.
Márcia.
Sorry.
So we've heard from UN Women who are saying that data about violence against women and girls has improved in recent years, but clearly we're not getting the full picture. Roxy, just spell it out for us. Why is it, and Leila and all our panelists have already started to talk about the importance of more data, more accurate data. How can data, how important is it in helping stop gender-based violence?
So I think it's interesting because when people talk about data, they often think about numbers. So they're often thinking about the prevalence, who is affected, how are the people affected. But I think data also has a lot more that we can, lot more value. So I often think about the data in terms of the root causes. So who are the people who are affected? Are there specific risk factors that we could be addressing? And then for me, another important aspect is around the interventions. How do we then identify the best interventions to then target it? It's one thing saying we have a problem. How are we acting on that problem? So, at which point is the data on the burden sufficient for us to actually say, at this point we now should be acting? And then the last point is around evaluating then our interventions. We're putting in place interventions, but actually, is it making a difference? And I think for me, data moves us from this point of we always see the high profile case in the media. It often gets a lot of attention, there's often swift action, and it creates this narrative in our mind around a particular scenario in terms of gender-based violence. But most of the women who undergo gender-based violence don't experience that. It's often intimate partners, it's often at home, it's often underreported, and it's only through the data that we can tell that true story. And so for me, the data unmasks the truth, tells us the true story around the true burden, but also how do we then address this issue.
Leila?
I think we need to turn this on its head to some extent. We've been using data to tell the problem for women and girls on the issue of gender. And I think when we're trying to get the attention of those who can make a difference, those who can put the funds into place to support more data, to support more programming, unfortunately, we have to tell a story that resonates with them. And I'm going to use an example of an incredible project called the Women's Stat Project, and the work they did around women and security. This is a space where the focus area has always been on how to reduce violence and conflict. And take a wild guess where the attention of those who want to make the difference has been turned to. It's turned to the military, it's turned to the traditional ways of reducing conflict, improving negotiations. What are the factors contributing to the conflict in a certain setting, right? And then addressing that. What was missing in that space was a gendered lens, the gendered data that could have helped inform that. And what we saw Women's Stat Project do is it looked at the role of women, it looked at security of women and the role it plays in impacting security of governments. Now, if you go into a room with a member of Congress on the Armed Services Committee and say, I believe that security of women is the #1 indicator of security of states, they're like, please leave the room. You have nothing more to say. We have no time. Kofi Annan in 2006 made a similar kind of a statement, which was, this grandiose statement at the United Nations, the greater, we need to really pay more attention to development of women, and it will help improve the world. Kumbaya, love it, great, I buy it. That's not going to get us security, right? But what Dr. Valerie Hudson did in her work in Women's Stat was she looked at all the data points, 20 years worth of data points, that made the case for the link between the security of women and security of states. And for the first time, it got the attention of those who needed to pay it attention. We think of security as military officers. We think of armed men. We don't think of, when you think of, how do I get this government to be more peaceful? We think of potentially, what are the factors? Poverty could be a factor. Democracy could be a factor. Culture could be a factor. What we didn't think about was security of women. And she made the point in her data points that where you see inequality and violence against women, that's where you find the number one indicator of insecurity in those systems. And when you were able to go into that room with that data point, with that information, you can make a difference. Now, the road is long, and there are many more stories to be told, but this is how we've been using it. I think the point I'm trying to make is that the data points for women or gender-based violence has been used in a very compartmentalized space. And we need to open that with all the great data researchers and analysts to open the door to have that information flow out, to show all the points of relevance and how it impacts all of society.
We're going to hear more success stories.
And there is one, at least.
Very soon in our conversation. Márcia, tell us, how important is data in informing policies at the ministerial level?
I came from academy. I'm a professor, and I'm a researcher, and I'm a sociologist, so data is our professional life. So for me, it's impossible to think about public policies without evidence. So we need public policy based on evidence. It's the most effective way to improve social problems and public policies. So, for example, the gender violence is increasing or decreasing? How can I answer this question without data? How to identify the impact of some measures about gender violence? For example, in Brazil, we have the Maria da Penha law. It's a very important law against domestic violence in Brazil. And with data, we can identify this law is more effective for white women than for black women. Actually, the homicide of black women has increased in Brazil, and the homicide of the white women has decreased. So this kind of information, just if you have good data. So I think that's very important too. The investment in data collection and the techniques is very important. And that's the reason I'm very, very excited with the Vital Strategies research, because the quality of the methodology is amazing, but also they start to use a qualitative method to understand what's happening. So when we talk about public policy based on evidence, not about numbers, quantitative research, we can, specifically when we talk about gender violence, it's very important. We look at the experiences. So the collection, the data about violence can be quantitative data, but also qualitative data. And I think it's very, very important. And that's the reason it's so important for us in the government, look at this data and take decisions, look at this data. So that's my point.
Technology facilitated gender-based violence is something that is an increasing public health and human rights crisis, really. And it actually wasn't until I did research for this conversation that I realized I've been subjected to technology-facilitated GBV in the form of sexual harassment online via anonymous emails. Erin, you're doing research on this. It's a really wide-ranging topic, and how do you even begin to find or collect data on this? How do you define this?
Yeah, so most of the work that I've done at ICRW has been on tech-facilitated gender-based violence, which is a term my colleague Laura Hinson and her team coined in 2018 in this initial research they did in India and Uganda. And they developed a framework that looked at the issue more holistically. So not the why, not only the why and the how and the relationship between the perp and the victim, but the context in which that violence took place, the impacts on the victim, and the help-seeking behaviors that come out of that. And so COVID really exacerbated the issue. We're becoming more online. We're doing all of our social activities online. And so the violence just really was exacerbated. And I think the underlying causes of tech-facilitated GBV are pretty similar to that of in-person GBV with some additional factors. One, your digital space, much wider, much broader than your physical space. When you experience in-person GBV, the person, whether you know them or not, they have to be around you. They have to be in your space. And that is just not the case with tech-facilitated GBV. You can have people in your community, in your school, in your workplace, your friends, your family perpetrate violence against you online on digital technologies through your phone, but they don't have to. It can be someone around the world. And the vastness and the connectedness and often impersonal nature of tech violence just really decreases the barrier to entry for people to perpetrate violence. So, we have people doing it anonymously like you experienced. And in doing that, and to someone especially you don't know, you're not seeing the impacts of your violence like you are if you're perpetrating it in person. And it really, there's also this group nature of online violence that can happen where you're seeing everyone doing it, so you might as well participate. And it makes it easier for you to participate in that. And the other issue is kind of this gender digital divide. So the inequalities of men and women using and accessing technology and digital devices really creates a vulnerability for women, particularly in experiencing violence, but also other people of intersecting identities. Like we saw that youth are online a lot more than adults, so they're experiencing at really high rates. People of marginalized identities, the LGBTQI+ community, of racial and ethnic minorities, of lower caste and class, they're experiencing at a lot higher rates. And then, women in public careers like yours, they're having to put themselves online to further their career, and therefore they're just exposed to a lot more opinions and people, which unfortunately is what the internet does.
And this can also go offline though, can't it?
Yeah, so we also see that it's really connected to offline violence. Women, if you're experiencing online violence and you're being victimized, you have a greater chance of experiencing in-person violence, especially if someone close to you is doing it. If your partner is sending explicit images of you to someone that they know without your consent, that's online violence. But they could then take that power and perpetrate violence against you, and now it's in person. And so it's not only an emotional and a mental and possibly financial or societal experience that you're having, now it's a physical as well.
So you are now working on putting together a bank of questions on tech-facilitated GBV for the DHS, what was it, Demographic Health Surveys.
Yeah.
Right, which is very important overall because it's going to help you collect this vital data. What kind of data is most important to collect right now?
Yeah, we got asked by DHS to help put together a kind of a pilot set of questions on this that they are hoping to pilot in the domestic violence module later in the year with some countries. Excuse me. And so we had a lot of these conversations. I worked with my colleague Connor Roth on it, and we're having conversations. Okay, so we have a very limited amount of questions to add. It's so difficult to get questions added to the DHS because of the time and the money, and that it has to be, questions you can ask across cultures. And adding questions it's a really big thing for them to want to do, and
across cultures, because the DHS
it's global. Yeah, and so they asked us to help put together questions for the DV module, and we had conversations like, what is the most important? Is prevalence most important? Okay, so if we only have a few questions to ask about prevalence, what kinds of violence should we be asking about? And if we only have a few questions, we should really ask about really gendered questions that we know explicitly, sextortion, non-consensual sharing of explicit images, those are very obviously gendered. Whereas other questions, other things like harassment could be gendered, maybe it's not. And so you're having to then ask 3 more questions to get at, is it a gender-based violence issue or is it just an online violence issue? We don't have that space. So, we're having those conversations. Another thing that we think was really important, that we suggested to them, this is all, they're now have taken it and hopefully will do with it what they please, but is like the impacts of it is kind of what they were talking about. The impact of the violence, whether short-term or long-term, really is a data point that gets at stakeholders wanting to make a difference. So for tech violence particularly, we see often that women experience violence on Twitter or Facebook, and then they remove themselves from the platform because the reporting systems are bad, and they know that women, or that the platforms are not going to take care of them, and they can't go to the police because the police are not really sure what to do with that. And it could be someone across the world and anonymous, and you can't find them. So they just remove themselves from the platform. So if we come to Twitter and Facebook and we say, people are taking themselves off the platform because your policies are not good enough, that's powerful. They want people on their platform. So it's data like that that you have to really consider how you're going to use the data and then what you need to actually get the change.
So that's tech-facilitated GBV, so complex. What about other forms of gender-based violence? Roxy, how do you get past these reporting barriers and get better data?
Yeah, so linking my first response and the second around the barriers, but then also the type of data we're looking at. So if you remember, I said one of the big issues is around cultural norms and that. And so I'll just talk to a small example around projects that's been done across the world called Stepping Stones that have looked at young men and women and have sort of identified this program that they work with young men and women to target both cultural norms, but also factors that influence HIV. And they have shown lots of success. And it's something that's very difficult, changing a person's cultural ideas around how they see men versus women is something really, really difficult to tackle. And so that's been a really interesting project that's occurring across the world. And I think some of my colleagues are involved in other work looking at the prevention side and also trying to get the data on that. You remember I said we need to have the data that talks to the intervention, but also evaluate those interventions. And then in terms of one of the other barriers that I mentioned was around access to services. How do we ensure that we give people access to services without always forcing them to report it and follow the legal route, knowing that not everyone wants to follow that route, knowing that there's a lot of challenges in terms of whether they're going to see any sort of benefit from that. And so in Mumbai, for example, we've been working with what we call one-stop centers. They are centers that have been established to connect women to medical care, but then pull in the other relevant services. So pull in police services, pull in the social protection services, pull in the mental health services, which is often a neglected area in post-rape care. And this has been established in a number of countries, but in Mumbai is one of the first examples. And they've now established 11 of these centers in hospitals. And it's been, it's existed for a while, but we went and started looking at the data that they're collecting and have recognized that it wasn't standardized, the quality wasn't, at the level that we would want. And so working with the government officials and the people within the one-stop centers, we developed what we call a monitoring and evaluation framework that helps them to sort of have very standardized indicators, collect the data on the woman that they are providing services to, but then also looking at what other services are they referring them to. And I think that's been very important because it not only helps the government officials in Mumbai to ensure that the services that they're offering is of high quality and it's actually addressing the needs of the woman. But a few years ago, I was involved in a WHO review. The WHO was developing clinical guidelines for post-rape services for women and children. And so I actually looked at the evidence around healthcare service delivery models. And there's very few studies or projects that look at the one-stop center as a model. A lot of countries, as I said, have established it. It's a very resource-intensive model, but we actually don't know that if women are accessing services in this model, are we actually seeing better health outcomes? Are we actually seeing that more cases are being prosecuted? Are they getting access for the women who do want to access services from the police? Are they actually having higher cases of prosecution? Are they getting better health outcomes? Are they having better social protection services? And so for as a government or as WHO, if you're trying to advocate for a specific model of healthcare, you need to have the evidence to say, okay, you only as a government have a limited number of resources in terms of financial or human. How do you sort of organize your services to be the most effective and the most efficient? So it sort of connects, it provides the data that can be used at a global level, but also, even in the city of Mumbai itself.
And even when there is accurate data, it's not always utilized properly, right? You might have the police who know something, but that doesn't get to the powers that be who need to see this information. You were telling us, but when it is used properly, we can have breakthroughs, successes. She was telling us about Valerie Hudson. You've got more success stories.
I actually promised this was not rehearsed, although it sounds like it was, because she mentioned Stepping Stones. Was this Stepping Stones International? So our work, I'm going to come back to Valerie Hudson's work, but on the issue of examples, programs that work, those data points are critical. Where we have evidence-based practices and programming on the ground, bringing about change. And we can grab that information both in terms of data and reporting on how it has changed behaviors, but also in direct narratives and stories that touch your heart. Both of those types of data points, qualitatively and quantitatively, can make all the difference. And in the case that you were mentioning, one of the areas we work in Futures globally is our Coaching Boys into Men program. And what we've done is we go on the ground. We're doing it for a long time in the United States with American football players. We were using the sports model of a coach as a mentor to provide the 12 weeks of football season, basically, to use that time period to influence the conversations in the locker rooms of all places about equity, about justice, but really specifically about respect, about preventing online abuse, gender-based violence on abuse. All of these conversations with these athletes, we collected data for. And that data point started to make an impact over time. Because prevention work, as many of you already probably know, is very hard to get funded to advocate for. Whether it's US-based or internationally, you have to prove something that doesn't exist. So having that story, that narrative for a long time is really important to provide those data points that made a difference. And so as a result, what happened was this US-based programming was translated into international programming. So now there's CBIM being used on a lot of soccer pitches or football pitches throughout Africa, 9 countries to be exact. South Africa was one of the places where we did the training. You can make a difference, but it takes a long time. But the success story with Valerie Hudson was really critical. During the Trump administration, we were able to pass, and we haven't passed a single bill related to gender even under Obama, we weren't able to pass anything. We haven't passed anything under Biden administration. We were able to pass the Women, Peace, and Security Act, which is a very important piece of legislation that talks about the need to increase women's access to decision-making tables. It's an international facing piece of legislation. We passed that during the Trump administration. And the key person that helped bring that about was I'm gonna give credit to her, was Dr. Valerie Hudson and her briefing on the role of women, the security of women, and its link with security of states. I mean, I can't think of a better example of how data made a difference in the policy space.
I'm going to hurry everybody a little bit because our time is ticking here. Erin, do you have any quick examples?
Yeah, I mean,
share?
other than the DHS work, which I think is a really big success for the field with the potential of collecting data like so globally, we're also working with Save the Children to adapt the original framework for children and adolescents. So later this year, we'll be collecting data from children on this issue and adolescents at a few countries around the globe, and we'll be talking with experts in the field. And I think the biggest thing in this area is that people are starting to talk about it. People want to put money towards it. People want to work on it. And that means we're getting more data, and that means we can create more solutions. So, yeah.
And very quickly, if possible, Márcia. So with your job at Brazil's Ministry of Racial Equality, you're helping, working to ensure that the Brazilian government meets its promise of racial equality, right, for all races in Brazil. How is racial equality linked to stopping GBV?
I think racial equality makes
gender-based violence?
Gender-based violence worse. So worse. Because racial equality and gender is one of the most challenging to Brazilian policymakers today. Because the black women improve several of conditions like education, access to labor market, and the number of the children they have, and continues worse and worse than the white women. So the question is not about social difference, it's about racism. So we can't face GBV. I'm so tired today, sorry. This is my second presentation today. We can't work on GBV without include racial issues. So I think I suggest to work on RGVB, because that's we needed racial gender-based violence, because racial gender-based violence, because that's the point. The situation of the black woman in Brazil is getting worse, and worse. And also, you have a consequence of the gender violence in other areas, such as reproductive rights, and it's a very complicated agenda in Brazil. We can't talk about reproductive rights in Brazil without a lot of confusion and fight with conservative agenda. But the reproductive rights is important because this is related to violence because of the rape. So we have law in Brazil to assure the women to stop the pregnancy when she's a victim of the violence, but sometimes, or most of the time, it doesn't work in Brazil. So, and you look at the face, the situation, these girls and women, they are black, because the white woman go to the private clinic, solve the problem, but the black women in Brazil needs the public health system to solve this problem. And most of the time, the 2 years ago, maybe or more, and during the Bolsonaro's government, you have a huge case because the Minister of Family and Human Rights, I forgot her name now, Damares, and she report a girl, 10 years old girl, she was raped, and she asked for support in the public health system. And this created, it was a nightmare because the conservative, the government trying to stop her to do this, to interrupt her pregnancy, and start a huge discussion between the conservative party and the progressive parties in Brazil about that situation. But there is a law to support her. So sometimes even the law can't solve the problem, especially if you're a black girl from the northeast and the north region of Brazil. So that's the reason, that's how this problem impacts for, so the racial vulnerability increase the situation all the time. I have a lot of examples about this. Just when you talk about people in the internet and social media, Djamila Ribeiro is the most prominent Brazilian or international black activist. And she left Twitter about 2 years ago because of violence against her. And at the decided to left the account, but that's the question. They we lost
Voice.
as well, because we lost a very important voice.
Thank you, Márcia. Very quickly, I wanted to just touch base on this plan that the US, the White House has just announced, just last week actually, a national plan, the first ever US national plan to end gender-based violence, and Futures Without Violence, Leila's organization, helped to inform this.
It's really exciting. U.S. has always been in the forefront of working towards ending domestic violence. For decades now, we've had the Violence Against Women Act, which has funded a lot of the shelters and programming and trainings. But we've never had an actual plan that was something that's a commitment that U.S. makes to the international community. It's really something many countries have already put together, have implemented, and U.S. had not kind of stepped up to that obligation, so to speak, and it finally has. It has made public its National Action Plan to End Gender-Based Violence, which is a domestic-looking plan, but it does still have an international impact because it holds us up and says we are now accountable. You too, the global community, can look at our plans and see where our shortfalls are. And informing that plan was a privilege and an honor for Futures Without Violence. And one of the areas we helped, really, because that's our bread and butter, is the work we do in prevention. And one of the key important pieces in that was asking for, and we saw it in the plan, an increase. And this is how we improve the data. We have governments back that up. We have governments invest in data collection and programs. And U.S. government in this plan has made its commitment to see an increase in evidence-based research and data collection. Prior to the NAP release, there was another piece of good news. U.S. government also released its U.S. strategy to prevent and respond to gender-based violence globally. And that program also has this commitment, under one of its pillars, a commitment to increase the collection of data and increase the research. So all of this is to say data does matter. Please keep collecting it. And for those of us that are on the Hill, we will try to fight for more funding for it.
Here. So very quickly now, we're going to open the floor up to a couple of questions from the audience. If you know who you want on a panel to answer that question, please do include that. Anybody have a question? Do get engaged. It's your chance to ask these. Please, sir.
Hi there. Thank you. Excellent commentary. Really interesting. I guess one of the things that came out of this for me was the importance, or the growing importance, of kind of intersectoral work. I mean, your story about using women's data to talk to people who care about security, and your story about drop-in centers that are also about security, but also about mental health, and kind of unsiloing GBV from, and it seems also like the bigger trend post-COVID, people realize these siloed systems aren't serving people. So I just curious, is this, the future of GVV to be pushed or like to, share agenda with other health areas or, can you talk a little bit more about this kind of like sharing agenda with other health areas or other public health, active?
Who wants to take that?
I'll do a quick version. And then, so what we saw was, and what we asked for, exactly, I think you should be on the panel, by the way. But we did ask for both in the National Action Plan and in the GBV strategy, which is the global facing one, that the work of gender-based violence must be intersectional, that it has to cover all the bases. It can't just be siloed by itself. And that is a result, again, of the data that informed the arguments, right? Because we can go in and ask for what we want, but unless we can provide evidence, it's not going to be as effective. So that is, hopefully it's not a trend, hopefully it's really progress towards saying that the importance of, it's really the root of the gender-based violence is equality. It really, at the end of the day, it's all about equality between men and women, and basically equality overall. And if that conversation can't take place, if we can't talk about equality, and if we can't talk about race in our work, then everything is siloed. And everything that we're trying to fix is just going to be a Band-Aid here and a Band-Aid there. So,
Márcia, you want to add to that?
No, she's done quite a good job. I was going to also, provide very similar comments. And obviously thinking about the prevention, areas, the focus is, I would say, intersectoral across the board, and prevention, especially around equality. I would say health does play a very important aspect once, there's been a perpetration of violence. It's a very important entryway that we don't often recognize. We often think about rape and think about the legal aspect, and maybe I'm slightly biased being a physician, but I do feel that health plays an important role, and we don't realize how often women access health services. They're coming in for antenatal care. They're coming in for maternal health services. There's a lot of opportunities to have these conversations with women to identify these cases of gender-based violence. Now, of course, as I said, that's picking up on the burden and then being able to help them to access the necessary care. But thinking at it from a prevention measure, there's many other areas as well that we need to consider. Thanks.
Anyone else? Last question.
No pressure, and thank you all so much for your time. My question is about, I guess, sort of in the intersection of the U.S. government and foreign policy around GBV, and how do you prevent kind of the legacy of colonialism from kind of reperpetrating in how the U.S. Attempts to influence policy abroad? I know it's a kind of a large question, but I imagine there are a lot of relationships there that you can kind of just see reborn in gender-based violence, and then in the way that governments try to influence each other, especially former colonial power against former colonized nations, and just sort of curious on your thoughts on how that can be addressed, prevented, looked at, considered.
I can do a quick response to that. One of the solutions has been that what we ask for is that the U.S. policies and programs focus on and support locally owned, locally run, locally organized civil society organizations. So the US piece of it comes in if they want us to come in. But that what we're really setting up is for their voices to be heard, because they are the experts of the problems on the ground. It's not always perfect, but it's a start.
All right, to wrap up our conversation, did you want to add to that?
It's a wonderful question. It's very difficult, but I think in Brazil we have some collaborate agreement with USA about racial discrimination, and I think the best way to think about this connection is the Black activism, the whole of the Black women, and in the world, I'm part of the Brazilian mission in this conference, the Permanent Forum of Afro-Descendants in United Nations this week, and all the discussion about how we create networks and connections between South to create more strategies to face different kind of discrimination. So I think that's one of the ways politics. You know.
Let's wrap it up now. And one final takeaway for our audience: how do we end gender-based violence? I know it's impossible to answer in 30 seconds or less. One thing, maybe, if we could start with you, Márcia.
Sorry, I didn't understand the question.
Can we end gender-based violence?
I hope so. I think we need to improve how we collect information and about this gender-based violence, and we need more the participation of the civil society to pressure government to create more and more information. As I said in the beginning of the speech today, it's data is knowledge, knowledge is power. So that's the way we can end this. Thank you.
Yeah, I mean, I can pass it over when I'm done. Here you go. Yeah, I also hope so. I think it's about really bringing all of the stakeholders together to have the conversation. Gender-based violence is a issue deeply ingrained in our structures, like I said, and every stakeholder has to be involved, and we need to be doing action and solution-oriented research to really figure out not only what the data is we need to be collecting and how we can use it, but yeah, what to do with it afterwards, and what actual solutions are in various contexts. Yeah.
Include men and boys. I think that we have for a long time spoken about gender-based violence. The reason we're using the word gender is because it's not supposed to be just about women and girls. It's supposed to be, there is a violence being perpetrated against young boys when they're expected to behave in a certain manner. Not just the violence they physically experience, but the control on their emotions, the lack of growth of their expression, their inability to be able to speak to how they feel, what it means to be a man in society, what it means, what are the responsibilities on them. All of that piled on our young boys increases the pressure also on them. So to treat this as they are a partner and that they can be part of the solution, not that they're just the perpetrators.
Roxy.
I think they answered everything, but I was also going to say, I wish we could solve this in 30 seconds. We've been all working, we've probably all been working here for more than 30 years in the field, and we still haven't solved it. But I think, as you said, things are improving. Although we may not realize it, I think we as you said, we're already seeing improvements in reporting, and that's an indication of the advocacy work that's been done years ago. And so for me, again, I would say invest in the data. Look at the data, recognize what are the important data points that we need, how do we need to share that data, and invest in those data systems. Thanks.
Wonderful. Thank you so very much, ladies, for your vital insights into how important a piece data plays in the solution. Thank you for your commitment to public health and for helping to create a healthier, more equitable world for us all. Thank you also to our audience for your participation. Let's now welcome to the podium Sharon Kim Gibbons, who is Vice President of Vital Strategies, Public Health Programs, to give us her closing thoughts.
Thank you, everyone, and thank you, Shax, Márcia, Erin, Leila, and Roxy for sharing your wisdom and your experience with all of us, and of course for representing the work of so many of our colleagues and their teams, because none of us do this work alone. So thank you so much. I'd like just to take a few minutes before we end the evening. I realize I'm the last person standing between you and some wine and cheese, so I'll be quick to say the original question was, can data end gender-based violence? So we've had a great discussion, a lot of different perspectives. So back to that question, do we think all our efforts can data end gender-based violence? And I would say collectively we've all agreed that it's a yes, but it's a highly conditional yes. I think we would say that if that is good quality data, is it complete? Is it accurate? Is it consistent? Makes a big difference. And I think we'd also say that you have to ask the right women the right questions. because as Márcia mentioned many times, the risk is not equal, right? Yes, we use the 1 in 3 number, but the risk is not equal. So you really need to really think about who you're asking and what you're asking. And as our colleagues in Brazil are talking about, looking at some predictive risk sort of indexing and evaluating is really important because, again, it's not equal for all of us, and we all know that based on socioeconomic, social conditions, and other indicators. So we would say yes, we think data can end gender-based violence if we do it well. And we know that we can learn so much from what the trends can show us, right? So if we watch this data, we look at it, we study and analyze it over time, we can learn a lot about behavioral different social conditions that are contributing and underlying and driving the gender-based violence. And then something that Roxy referred to, which is also really critical. Of course, if we use the data, it has to be used in the appropriate policies and programs and services. However, we often stop there and we don't go back and evaluate whether those things that we designed worked. So we can't forget sort of the post-policy, post-program design phase. You have to go back and see. You may have been off. You may have missed the mark. You better learn to see whether or not you're effective. And so I think data will tell us a lot about some of the post-program and policy work ahead. So we also wanted to say that we think everything from a large, DHS national country level survey is important, but also a small qualitative focus group that can also be very informative. Certain anecdotes, testimony, those are also quite powerful. Let's collect those and let's put that all together. I think with public health, it's so complex, and we all try to be as predictive and analytic as possible, but it's often so nuanced between cultural and different factors that I think it takes so many of our allied colleagues. So we need to talk to the judicial system. We need to talk to the education systems. We need to talk to, of course, the health sector and a lot of the social scientists as well. So it takes all of our data together collectively, and that learning has to be pulled together, discussed, and then all brought together so that these programs and policies can actually be effective. I think that if we don't study true power dynamics and the social and gender norms that underpin them, we won't be getting very far either. So let's talk about power dynamics and how do we really evaluate and measure what's really going on at the different country level, community levels. So I guess without, I could go on for a long time, but I would just say that there are so many different inputs and angles and data points to pull together that unless we share this all and we continue to fund the investment in this, we probably will be making much slower progress than we wish. I will say I do think that the contributions of our advocates and our researchers and our scientists and our lawyers all are really critical, but there's still a lot to be known about the magnitude, right? So any of the policymakers, what's their first question? How big is this problem? And unless we have an answer, we're not really going to get the funding or the attention we need. So I would say we must forge ahead and continue to do what we're all doing, fight the fight, share our knowledge and learning, and hopefully we can minimize this terrible, life-threatening situation for so many of our colleagues, friends, and communities. So with that, again, I wish I could wrap up everything in a nice little bow and say we figured it out and we have the answers, but we don't. So I'll just say, again, as public health practitioners, we forge ahead, we use what we have, we continue to try and improve along the way, and hopefully we have a positive impact on our populations. Thank you so much for your time. Thank you for coming this evening. And of course, we can continue over some wine and cheese and snacks and continue this conversation. Thank you so much. We really appreciate your time on a very busy spring evening. So thank you.